If you have ever traveled somewhere completely new, and you walk into a local restaurant, sit down, and they hand you a menu the size of a novel.
Oh, I know that feeling.
Right. And it's entirely in a language you do not speak. You're just staring at it. You know you're hungry, and you know there is food in that kitchen that will sustain you.
But you have absolutely no idea what any of the categories mean.
Exactly. You don't know how the ordering process works or, what is actually going to show up on your plate if you just guess and point at something.
It is a profoundly overwhelming feeling, and in that moment, you don't want to, learn the language from scratch.
No, not at all.
You just want someone to sit down next to you and say, okay, here's how this menu works, here's what these dishes actually are, and based on what you need, here's exactly what you should look at.
And that feeling of sitting there, staring at a massive, confusing menu that is exactly what it feels like for so many families when they first start looking into Department of Veterans Affairs home care benefits.
Oh, absolutely. It's daunting.
You have a loved one, a veteran, who just wants to stay safely in their own home, and you just want to help them do that. But you open up the VA manuals, and suddenly you are drowning in this alphabet soup of programs, eligibility matrices, and just overlapping healthcare systems.
It's enough to make anyone want to close the manual and walk away, which is, of course, the last thing we want.
Right. So to all of you listening out there, especially the veterans and the family members who are likely listening to this deep dive while driving to a medical appointment or, folding laundry or juggling a million other caregiving tasks, welcome.
We are so glad you're here.
Our mission for this deep dive today is to basically be that translator at the table. This is part one of a new series we're doing, and we are going to provide a clear, plain language landscape overview of the VA's home care options.
Setting that landscape is really the crucial first step because a lot of people approach the VA assuming there's just one big umbrella called the VA home care program.
Right, like it's just one thing.
But there isn't. The VA actually offers multiple, entirely independent programs designed to help veterans age in place.
Okay, so looking at how these sources are structured, it seems like we need to separate the specialized, highly specific tools from the everyday long-term programs.
Yes, exactly.
Because otherwise the terminology just bleeds together. So let's clear the board of those specialized options first.
That's the best way to map it out. It really helps to understand these specialized options so we know when to use them, but also, when to look elsewhere. So the most acute one is VA skilled home health care.
Okay.
The absolute key word to remember here is skilled. This is for clinical or medical needs.
So we aren't talking about a caregiver coming over to help with meal prep or folding laundry.
Not at all. We are talking about licensed nursing or specialized therapy services. Usually, this is triggered right after a hospital stay or maybe a stint in a rehabilitation facility.
Okay, that makes sense.
The VA authorizes a contracted licensed home health agency to come into the home and handle a specific medical issue.
Let's put a face to this to make the mechanics clear. And actually, just as a quick note for you listening, to establish a ground rule for this deep dive. Whenever we share a specific person's story today to show how these benefits work, here is a hypothetical example.
Right. These are fictional composites to illustrate the rules, not real clients.
Exactly. So imagine Frank. Frank is a 68-year-old Vietnam veteran. He just got discharged from the VA hospital after a major hip replacement surgery.
Okay, so Frank's situation is exactly what this is built for. He's going to need physical therapy, maybe some specialized wound care for the surgical site, and, close medical monitoring.
Right.
The VA Skilled Home Healthcare Program covers that. But the vital thing to remember is that it is generally short-term. Once Frank's hip is healed and his, say, 6 weeks of authorized therapy are done, that specific skilled medical intervention ends.
Okay, so Frank's hip heals. The skilled nurses pack up their bags and discharge him. But for a lot of families, that is when the real marathon begins.
Oh, absolutely.
I mean, the spouse or the adult child takes over the day-to-day caregiving, and from what I've seen, the grind of that leads straight to caregiver burnout. Does the VA have a mechanism just to give the family a break?
They do, and it's a vital part of the landscape. It is called VA respite care.
Respite care.
Caregiving is exhausting, 24/7 work that takes a massive physical and emotional toll. So, respite care is specifically designed to provide temporary relief for a family caregiver who is approaching that burnout phase.
Which happens to almost everyone
Like,
eventually.
it gives the primary caregiver a scheduled break. It can be delivered by a professional coming into the home, or it can even cover a short stay in a nursing home facility up to 30 days per calendar year.
Okay, let's do another one. Here is a hypothetical example. Take Jim and Carol. Jim is a 71-year-old Gulf War veteran who had a severe stroke a few years ago. His wife, Carol, has been his full-time caregiver ever since.
That's a heavy load.
It is. She hasn't had more than a few hours to herself in over a year. She is completely depleted.
In that scenario, their VA social worker could arrange for weekly in-home respite. Maybe an aide comes in every Tuesday afternoon so Carol can safely leave the house to go to the grocery store alone, or honestly, just take a nap.
A nap sounds amazing in that situation.
Seriously. Alternatively, they could arrange a short nursing home respite stay for Jim so that Carol could finally travel out of state to attend her sister's wedding. The focus is preserving the caregiver's health.
That preserves the family unit, which makes sense. But what if the veteran themselves wants to be the one calling the shots? I mean, respite brings in an outside agency, but what if a veteran doesn't want an agency dictating who walks through their front door?
That's a great question. Then we look at a program called Veteran Directed Care, or VDC.
DDC, okay.
This one flips the traditional healthcare model entirely on its head. It is a consumer-directed model for veterans of any age who need long-term services, but who want absolute, total control over who provides that care.
Wow, okay. How does that work?
Instead of the VA contracting an agency who then assigns an aide to the house, the VA provides a budget. The veteran, or their designated representative, acts as the actual employer.
Wait, really? They're essentially running their own small caregiving business. They do the hiring and firing.
Precisely. They select, hire, and direct their own care workers.
Okay, so here's a hypothetical example. Think about someone like Maria. She is a 54-year-old veteran with a spinal cord injury. Maria has a very specific, intimate daily routine.
Right, she has a system.
Exactly. She doesn't want an agency sending a stranger to her house or dealing with the turnover of a different person every few months. She wants to hire her longtime friend and fellow veteran Denise because Denise already knows her routines perfectly.
That makes total sense. And under veteran-directed care, Maria gets the budget, she officially hires Denise, and she manages her own care.
That's pretty incredible.
It gives immense freedom to veterans who are comfortable managing a budget and taking on the administrative role of an employer, but it is undeniably a lot of responsibility.
And that is where I'm getting a little hung up.
Yeah.
I'm looking at these three options we just walked through. We have short-term medical for Frank, we have a temporary break for Carol, and we have Maria essentially running her own payroll and human resources department.
Right.
Those are very specific puzzle pieces. What if a family just needs standard, long-term help around the house, help with bathing, dressing, meal prep, and they absolutely do not want to become an employer to get it?
That is the crucial pivot point, and it transitions us from those specialized tools to the core program that the vast majority of families should actually be looking at first.
Okay, so this is the big one.
If we go back to your restaurant menu, this is the main course. It is called the VA Homemaker and Home Health Aide Program.
The VA Homemaker and Home Health Aide Program. I know you'll sometimes see this written as HHA in the brochures, but let's just stick to the full name so we don't get lost in the acronyms.
Good call.
Break this down for us, because this sounds like the heavy lifter.
It is the heavy lifter for non-medical daily needs. Fundamentally, it is a service benefit. That means the VA pays a contracted community home care agency directly, and that agency employs and sends a trained caregiver to the veteran's home.
To do what exactly? Like what kind of tasks?
To assist with activities of daily living, so that's bathing, dressing, feeding, toileting, and safe mobility around the house. They can also assist with meal preparation and light housekeeping.
Oh, wow.
Yeah, it's specifically designed for veterans who want to age in place in their own home rather than move to a nursing facility, but who simply cannot manage everything independently anymore.
I have to assume there's a catch here. Whenever I hear government benefit, my brain immediately assumes you have to drain your life savings to qualify for it. Is this strictly for veterans who are living below the poverty line?
No, and I'm so glad you brought that up. That is one of the biggest misconceptions out there, and it prevents people from getting help. The VA Homemaker and Home Health Aide Program is not income tested.
Wait, not income tested at all?
No. To qualify, you need to be enrolled in VA healthcare, meet community care eligibility, and have an assessed clinical need.
Assessed clinical need, okay.
Right. A VA social worker, nurse, or physician has to evaluate you and confirm that you actually require physical assistance with those daily activities or that you are facing significant isolation or caregiver burden. But your bank account balance does not automatically disqualify you.
That is huge.
It is. Furthermore, there is typically no copay for the first 180 days, which is the initial authorization period. Some copays might apply later on depending on your specific service-connected status, but the barrier to entry is fundamentally based on a health need, not a financial spreadsheet.
Okay, let's map this out. Here's a hypothetical example. Let's talk about Bob. Bob is a 78-year-old Vietnam-era Army veteran. He lives alone. He is still fairly steady on his feet, and he doesn't have any major service-connected combat injuries.
Okay.
But he is slowing down. Finding the energy to cook is exhausting, so he's skipping meals. Getting in and out of the slippery shower makes him nervous, so he's skipping bathing.
Which is a critical, measurable decline in his activities of daily living.
Right. So Bob goes to his routine VA primary care doctor visit. The doctor flags this decline, refers him for a geriatrics assessment, and Bob is approved for a homemaker and home health aide caregiver to come to his house 3 mornings a week.
And notice why he got it.
Yeah, he got the help not because of a combat injury and not because he was broke, but simply because he had an identified daily living need.
Exactly. And that highlights what we mean when we call it a service benefit.
So the VA isn't just handing Bob a blank check. It is more like a prescription for care.
Oh, I like that phrasing.
Right. Just like a doctor prescribes a medication and a pharmacy fulfills it, the VA is the middleman here. They assess Bob, they prescribe the 3 mornings a week of care, and then the VA directly authorizes and pays the professional community agency to fill that exact prescription.
That is a highly accurate way to look
Yeah.
at it. The VA controls the authorization. They set the prescribed hours based strictly on the medical assessment, and they handle the payment directly to the agency.
Okay, but let's follow that logic. If the Homemaker program is a prescription for specific authorized hours, what happens if Bob needs someone there all day while his daughter works?
Right, that happens a lot.
If the VA only prescribes, say, 15 hours a week, how is he supposed to afford the rest of the week out of pocket? Is there a program that actually provides financial health for private care?
Yes. This brings us to the other massive piece of the landscape, the VA aid and attendance pension. And this operates on an entirely different set of rules, because unlike the Homemaker program, the aid and attendance pension is a cash benefit.
A cash benefit, meaning money deposited directly into the veteran's bank account.
Yes. It is an increased monthly payment added to a VA pension specifically designed for veterans or their surviving spouses who need physical help with daily activities.
Okay.
But because it is housed under the pension system, the qualification rules shift dramatically.
Walk us through the shift. How is it different?
First, it is generally restricted to wartime-era veterans or their surviving spouses. Second, unlike the Homemaker program, this is strictly means-tested. Your income and your net worth must fall within the VA's highly specific limits.
And we actually have the current financial thresholds from our source material. Now, a crucial disclaimer for you listening. The numbers we are about to share are effective from December 2025 through November 2026.
Very important point.
The VA updates these figures regularly, so you must confirm the current rates at va.gov for your specific timeline. But for that window, the net worth limit to qualify is $163,699.
Correct. And if you meet that financial criteria, alongside the medical criteria of needing help with daily living, you may qualify for a significant monthly payout.
What kind of payout are we talking about?
For a veteran or a surviving spouse with no dependents, it can be up to $2,424 a month. With one dependent, it can be up to $2,874 a month.
Wow, that is substantial. Are there any restrictions on how that applies to other pension add-ons?
Yes, there is one important exception to note within the pension system itself. There are different types of add-ons. There is the aid and attendance add-on we are discussing, and there is a different one called the housebound add-on.
Okay, and the rule is?
You cannot combine them. The VA will only pay one or the other, whichever is higher, and applies to your specific situation, but never both simultaneously.
Let's look at how aid and attendance changes the reality for someone. Here is a hypothetical example. Ellie. Ellie is 84 years old, the surviving spouse of a Korean War veteran.
Okay.
She lives with her daughter, and they are surviving on a very tight fixed income from Social Security. Ellie's arthritis has progressed to the point where she cannot bathe or dress herself safely.
Well, because Ellie's income and assets fall under that strict VA net worth limit, and because she has a documented need for physical assistance, she applies and is approved for the aid and attendance pension.
So suddenly, Ellie has an extra $2,424 hitting her bank account every month. She takes that cash benefit and uses it to privately hire a home care agency to come help her every morning. She is using the cash to bridge a gap that her fixed income could never cover.
Precisely. Now, if we pull back and look at the whole menu, we have our primary options. We have the specialized tools like respite and veteran-directed care. We have the core service benefit, the Homemaker and Home Health Aide program. And we have the core cash benefit, the aid and attendance pension.
Wait, I'm looking at how these are structured. If the Homemaker program is based purely on clinical need and VA healthcare enrollment, and the aid and attendance pension is based on wartime service and financial limits, they are running on completely separate administrative tracks.
They are.
Can you stack these?
That is the revelation for so many families.
Yeah.
Yes, because they are assessed independently, you can often combine them.
Wow. So they're essentially stacking benefits.
Yep.
The VA provides the foundational hours as a healthcare service, and the pension provides the financial scaffolding to fill in the gaps.
Exactly. You could receive the Homemaker and Home Health Aide services, where the VA prescribes and pays an agency for, say, 10 hours of care a week, but you still need more help.
Right.
If you also meet the financial and wartime criteria for the aid and attendance pension, you can receive that monthly cash benefit at the exact same time. You then take that cash and pay the agency privately for an extra 15 hours a week. You are combining the forces of both programs to build a comprehensive safety net.
That is incredible. But are there any hard stops, programs that absolutely clash and do not play nicely together?
There is one major exception that families need to navigate very carefully, and it involves the Program of Comprehensive Assistance for Family Caregivers, often referred to as PCAFC.
PCAFC, how does that work?
This is a highly specific program for veterans who had a 70% or higher service-connected disability rating. We are usually talking about severe, sustained needs, combat-related physical injuries, traumatic brain injuries, or severe PTSD.
Okay, so very high level of need.
Right. The program pays a tax-free monthly stipend directly to a family member who has committed to being the primary full-time caregiver. It allows that family member to dedicate themselves fully to the veteran's care, often replacing lost income.
So what is the catch when it comes to stacking that with the other programs we've discussed?
The catch is that PCFC generally requires that the veteran's personal care not be simultaneously and regularly provided by another individual or outside entity.
Ah, I see.
The entire premise of the stipend is that the designated family member is providing that comprehensive care. If you suddenly bring in a professional community home care agency to handle the daily bathing and dressing, it directly conflicts with the foundational requirements of the family caregiver stipend.
So you could risk jeopardizing your stipend if you aren't careful.
Exactly. Families must absolutely confirm with their specific VA caregiver support team before mixing PCAFC with any professional home care agency.
So, synthesizing everything we have walked through today, from the skilled nursing to the respite breaks, the service benefits, and the cash pensions. What is the ultimate takeaway for a family sitting at their kitchen table right now, just trying to figure out how to keep their dad or their spouse safe at home?
The primary takeaway is expectation management.
Expectation management.
Yeah, these programs are incredible life-changing tools, but they are incremental benefits. They are not a magical blank check that instantly solves every single problem or provides 24/7 care for free.
Right.
The goal of the VA is to provide enough incremental support, whether through a few prescribed hours of service, a bit of respite, or a monthly cash supplement to make a meaningful difference. The goal is to make aging independently possible, not to fully replace all private care.
Incremental benefits. It is about building a bridge, plank by plank, rather than expecting a helicopter to drop you on the other side.
That's a great way to put it.
Well, we have covered a massive amount of the landscape today. But if the Homemaker and Home Health Aide program is the main course that most families need, how do you actually get it on the table?
That is the practical question. What actually happens day to day after you get approved?
And that is exactly what part 2 of our deep dive series is going to cover. Our next deep dive is dedicated entirely to the Homemaker and Home Health Aide program, the one most veterans and families ask about.
It's going to be a good one.
We will walk you through the assessment, the agency matching, and what that first week of care actually looks like. So I encourage you to cue that up next.
And as a reminder, while we have laid out the landscape today, we cannot state or imply eligibility for your specific situation. The rules are complex and, deeply personal.
Absolutely.
Your very next step should be to contact an accredited veteran service officer or call the VA directly at 800-698-2411 to ask questions about your unique circumstances and see what you may qualify for.
Make that call. It is the best first step you can take. We also want to send a warm thank you to the presenters of our source material today, First Light Home Care of Metro Atlanta.
Yes, thank you to them.
They have been proudly serving veterans by honoring them with quality caregiving so that veterans can independently age in home with dignity and respect after approval has been given. If you are in their area and want more information on navigating the Homemaker or aid and attendance programs, give him a call.
It's a great resource to have.
It really is. Thanks for joining us on this deep dive, and we'll see you on part 2.